Hey guys, it's the VAC to the -E Vic-E back with another video, and in this video I'm going to be reacting to a video where a doctor talks about Lichen Planopilaris in women. I have tons of things to say about this video, but before we get into that, I'd like to ask you one little favor. Could you please subscribe to my channel? By you subscribing, you're showing that you're interested in getting to know more about me, that you are excited about this content. And if you're already subscribed, please consider liking this video. It shows me I should be creating more of these types of videos. Guys, now that we have that all done, let's get into the video. Okay guys, so as you may or may not know, I have Lichen Planopilaris, or I think the right term is lichen planopilaris. And it's a disease that actually impacts your scalp. Your hair is attacked by your hair follicles are actually attacked by your body, and it slowly eats away at your hair until you have scarring patches all over your head. So it's a form of scarring alopecia, and I've been very candid about my struggle and my journey if you want to check that out. I'll have the link down below to that video. And I've also done an interview with someone, a woman named Geneva Lewis, and she talks about all the things that she's been through with the same exact disease. I plan to create more videos about this disease along with other alopecia videos, because I think demystifying some of these things can really be helpful, one, to the people suffering with it, but also to the larger audience, because you'll understand and be a little bit more sensitive when you see people struggling with their hair, or at least I'd hope you'd be. Please, thank you. So let's get into the video. Okay guys, here we go. So, Lichen Planopilaris in women. This was made August 3rd, 2020.
Our goal was to identify a large group of women with Lichen Planopilaris, which is a form of scarring or cicatricial alopecia, and learn more about these women and what symptoms they present with, how long it takes to make these diagnoses, as well as some of the treatment options. My name is Stan Tolkachjov, and I'm the director of nose and micrographic and reconstructive surgery at Vic-E Dermatology in Dallas, Texas.
To learn more about
on this project, we worked with a group from the Mayo Clinic who are very dedicated to treating patients with hair disorders, including Lichen Planopilaris, as well as frontal fibrosing alopecia. The group included the primary author, Sydney Proffer, as well as Hafsa Cantwell, Reese Imhoff, Rochelle Torgerson, and myself. We did a retrospective review of women seen in the Mayo Clinic from 1992 to 2016 with Lichen Planopilaris. We identified 232 women. Lichen Planopilaris is a scarring form of hair loss or alopecia. It's most commonly seen in women, and the average age has been reported is around 48 years. The range of ages reported is 25 years old to about 70 years old.
Okay, so this is the first thing I want to comment on. The average is 40 years. Now, if you have the disease and you're not 40 years old, please put your hands up in the comments below. I think this is a common myth about the disease. See, I am not a doctor. Guys, I'm not a doctor, but one, my experience, I found out when I was in my late 20s. Two, me putting on my video, I've seen so many people like, I'm in my 20s, I'm in my 30s. I really haven't seen anyone who's like, I'm in my 40s talking about they have this disease, right? So, and even doing research on YouTube in general, like, I see people making videos and none of them, when they found out, were in their 40s. For the most part, like the majority weren't in their 40s as of yet. So I think it's more like they are having extreme symptoms maybe, or going to the doctor when they're in their 40s. But there may be smaller precursor things that people are not seeing earlier on, and they already have it active in their body, it's already active in their body. So I find that interesting.
31% of these women had thyroid disease, and hypothyroidism, which is low thyroid hormone, has been reported in women with scarring alopecia.
So thyroid disease, I find that interesting too. So my mom actually had a thyroid condition. I think she had hyperthyroid issue. So that's an interesting link. I haven't had any thyroid issues, but I wonder if there is any underlying something there.
Including Lichen Planopilaris, as well as frontal fibrosing alopecia, which is often regarded as a subtype of Lichen Planopilaris.
Okay, so frontal fibrosis is when it affects the front of your hair. Like, there are times where you'll see more loss in the front of the hair instead of, sometimes when you see like male pattern baldness, they'll have like the center of their hair or the top of their crown being affected. So this is the frontal lobe of your head being impacted, and they said this is like kind of another piece of it, underneath it. So that's interesting.
After reviewing the patients that we found in our search in the Mayo Clinic database, we identified 232 patients that met the criteria for Lichen Planopilaris. Out of these patients, we looked at their photographs, we looked at their biopsy results, and their charts, their histories, and looked for associated disorders such as autoimmune conditions. We also looked at treatment algorithms and what was used, and also to see how well these patients did in the long term, which is often difficult to do at a tertiary academic center such as the Mayo Clinic. However, with good record keeping and good follow-up, this is very, very helpful to see how patients do. Something that was very unique in our findings is the difference between the patients that had the frontal fibrosing alopecia, which we've reported previously, and the patients here we have Lichen Planopilaris.
See, one of the things they found, that the people with lichen, I'm going to say lichen because it's easier for me. I don't know, I'm so used to saying it, were younger. Isn't that interesting? Right? Something that we've been saying, like, oh wow, even though it's still in the reports, even though he said it in the beginning, oh, they were younger.
The patients with Lichen Planopilaris, they were a younger population of patients and also had less hormonal findings such as hormone replacement therapy as well as abdominal hysterectomy.
Hormonal, like, I don't even know enough about, I need to rehear that. Hold on. Wait, okay, I still don't get it.
Also had less hormonal findings such as hormone replacement therapy as well as abdominal hysterectomy.
So they had less hormonal findings. Let's look up what hormonal replacement therapy is. So let's also Google that. Hormone therapy is right for you. Medication that contains female hormones. You take the medication to replace estrogen that your body, back to the Mayo Clinic. Let's look at this. Okay, hormone therapy. Is it right for you? Hormone therapy was once routinely used to treat menopausal symptoms and protect long-term health. Then hormone replacement therapy is a medication that contains female hormones. You take the medication to replace estrogen that your body stops making during menopause. Hormone therapy is most often used to treat common menopausal symptoms, including hot flashes and vaginal discomfort. Okay, guys, so, correct me if I'm wrong. They're saying that women who don't need hormone therapy, obviously maybe they're younger, may have less hormonal issues, usually have it. So maybe they're trying to link it to, okay, if you're it's usually going to die down, which I heard happens in a lot of autoimmune diseases. It's going to die down once you hit menopause, possibly. I don't know, but that could be very interesting if that's the case.
Interestingly, a history of depression and anxiety were seen in 45% 5 and 42% of women, respectively. Clinically, women with Lichen Planopilaris present with a hair loss, usually the vertex of their scalp. There's tenderness.
Okay. He glossed over that. And I think when I spoke with Geneva, actually in our interview, we talked about aftercare. And one of the things that they don't do is they kind of don't support people with the mental anguish, because you go back to your family doesn't quite understand. You don't really necessarily have community, because there's not a lot of communities based on this rare disease that it seems to be picking up. And obviously I think it's so much of the world today and things, you know, toxins and stuff that's impacting us. Or maybe just the more discovery of diseases, right? And also a lot of people, it's a very, I guess, superficial disease, so people don't want to talk about it, and usually they hide in silence and suffer in silence, so they don't talk about it. But he said they're depressed. Yeah, it would make sense that they were depressed because they found out that they had an incurable disease. You know what I mean? Like, you're saying, well, they're depressed. Is the depression making them have the disease? I think it's more so finding out they have a hair loss disease and they don't know what's happening with their body. And then when they find out there's really no cure and some of the treatments are iffy. So yeah, there's definitely that. But how are you guys working towards correcting that? Because I think that could also help with people. That could also be a treatment. That's a part of aftercare that can help people keep more of their hair. That is one of my thoughts. But again, I'm not a doctor.
There's scarring, hair loss, there's some itch, and also some scaling. So this can often be confused with seborrheic dermatitis or plain dandruff. But once you look at a scalp of somebody with Lichen Planopilaris, you often see that scarring, hair loss, the shiny areas, and you also see the scale and the redness around follicles. The reason for Lichen Planopilaris is not fully understood. We do think that it's an autoimmune condition, and it is associated with other autoimmune conditions like hypothyroidism.
Okay, again, it is not completely understood, guys. Anyone who's trying to sell you a miracle cure, there's no miracle cure as of yet. Hopefully, Lord willing, there will be, but there is no miracle cure. And that's similar to a lot of immuno diseases. I don't think we have enough, as a society, enough information about these diseases yet. But yeah, he's saying there's really no cause.
I do think that it's an autoimmune condition, and it is associated with other autoimmune conditions.
Also, he's going to say it's associated with other, you know what, let's just keep it going, and I'll pause it after he says it. But, you know, I'm going to take it back a little bit.
I think that it's an autoimmune condition, and it is associated with other autoimmune conditions like hypothyroidism. And when we do a biopsy of the hair follicle and on the scalp, we often see the inflammation of T cells.
It is an autoimmune disease, guys, and it's associated with other autoimmune diseases. It could be a precursor to something else, or after having something else, it can cause this disease. Something definitely to look at and to pay attention to.
The inflammation of T cells called lymphocytes that actually attack the hair follicle at a certain region, which helps us make the diagnosis of Lichen Planopilaris. In some of our other studies, we've reported patients with a disease called frontal fibrosing alopecia, or hair loss in the areas of the temples, the eyebrows, and the frontal scalp that typically are considered as part of the Lichen Planopilaris spectrum. However, we separated these patients out of our search just to make sure that we focus on women with Lichen Planopilaris. And so the patients with frontal fibrosing alopecia have been reported elsewhere. However, patients that have the frontal fibrosing alopecia are typically older, although not always, and have more history associated with hormone replacement therapy and menopause. In our patient population, the average age of diagnosis was about 59 or 60 years old.
Okay, so I think that was interesting. People who were a bit older have issues with menopause and hormone, and they may have hormone replacement therapy for fronting fibrosis. So if you're younger, that may not affect the front of your hair.
4% of these patients had vertex or crown hair loss.
So 44% had crown issues. Not the frontal issues, but the crown. Definitely can think of some moments where, you know, it was more of my crown than anything else. But other people obviously have different experiences.
Lichen Planopilaris has often been associated with another type of lichenoid dermatosis. And that means it's a rash that has almost a purplish look to it and often is very itchy and can be all over the body, including the oral cavity. And so about 18% of patients in our study had oral lichen planus. Interestingly, the peripheral body hair was involved in 53% of our patients.
Okay, so that's also interesting. Even though it's a quote-unquote small percent, 18% actually had lichen or lichen planus, which affects other parts of your body, including your mouth or your skin. I know someone in my family who actually has it on their skin. And so this could, you know, kind of, you're building a case. He's building a case on this is something that impacts your genetics. So this is something maybe my children have to look out for. You know what I mean?
And so about 18% of patients in our study had oral lichen planus. Interestingly, the peripheral body hair was involved in 53% of our patients.
Okay, peripheral body hair. So he means other parts of your body hair? Like, I'm not sure. Let's look. Peripheral body hair. Okay, so peripheral body hair, once I looked it up, it says hair loss on legs, causes, treatments, and more. So one of the things that I have valued about my body growing up is that I barely, like, people would touch my skin and be like, your skin is so smooth, because I barely have any, like, hair on my skin. Like, growing up, now that I'm a little bit older, I have, like, little buds of hair on my arms, and I've actually, weird confession, I've never, ever waxed or shaved my legs because I barely grow any hair. And my mom didn't grow any hair on her legs. And my brother, who's half Puerto Rican, barely grew any hair on his legs, like, growing up. Where a lot of time, men, and in my opinion, I see a lot of Puerto Rican men might be a little bit more hairy. So I just thought this was something that was genetic with the rest of our family. Like, my immediate family, that we really didn't grow a lot of hair on our body. But now seeing this could be also another, like, these are things that if you are facing your scalp is a little itchy, getting flaking, or maybe early on, or this is something doctors can look at too, right? Early on, before you hit 40, let's say you're in your 20s when this is starting to happen, you could look at, okay, wow, this person's not growing any hair on their legs. This could be a precursor to this. Or look at their eyebrows, right? For me, I've lost a lot of my eyebrows, so much so, these are painted on right now, guys. So much so that one time I was walking outside and my friend was like, you shaved off your eyebrows? What's wrong? And I said, no, it's a part of my disease. And without your eyebrows, it doesn't make a difference. You look weird to people. You look different, right? They can't pinpoint it, but it's something that's different about you. So yeah, that's the peripheral body hair thing.
Other autoimmune conditions, such as celiac disease and inflammatory bowel disease, were also seen with these patients.
Okay, guys. Funny, weird. I know other people who have celiac disease. I know people in my family who have celiac disease. I know people in my family who have immunodeficiency, autoimmune diseases. So obviously that's something that is occurring in my family. I don't know if that's worldwide. Like, everyone in someone's family has 1 out of 10 people in your family have an autoimmune disease. I don't know. But I know in my family, we have several people who have an issue. And to be candid, I have a lot of people in my family who have died early, which is really sad. So I think that's why I'm exploring all these other connections as well. One of the things that I found interesting about this was that he talks about celiac disease, and he's going to talk more about gut health and your stomach, and things that impact what you eat and your health. Like your internal health could be impacting your hair. When people are trying to give us a lot of steroids and all these other medical treatments that can impact our outward skin, a lot of it is linked to our internal body, and possibly what I would say is allergies or bad reactions to things, because they're also linked to these diseases, or our body's already not accepting certain things. So I'm always kind of saying, well, what can we pay attention to our body is saying, and eliminate that and see if that impacts our health. But right now he's saying, wow, it's tied to these two other diseases that talk about your gut. So they talk about what you're actually digesting and eating. I know for me, one of the things that directly make my scalp itch, if I eat tons, not even tons, if I eat a lot of sugar, probably more than the sugar suggested for a day. And if I do it day after day after day, my skin will be flaky. I'll have some pupils on my scalp possibly, or something I can like kind of pick at, and it'll be itchy. Like even if I don't have the other symptoms like right away, within 30 minutes, maybe to an hour, I'm scratching my head unconsciously. So that's something that I've noticed as something that you put into your body that could be toxic for me specifically. So for him to say celiac, and he's going to say something else here, the fact that he says it and mentions this, should we, the people inflicted with this disease, should we be looking at celiac and other diseases similar and following those diets, things that you've kind of not cured but figured out treatments for, and seeing if we have positive responses to that with our hair? And that's before we get to a place where it's scarred and we can't grow our hair back. If we get to a place where we can treat it before the hair is lost, right? So I think it's part of diagnosing early, and then also finding the precursors, finding what could be obviously after effects, but also finding ways to eliminate flare-ups, right? Eliminate flare-ups and stop them in their tracks.
Interestingly, 2 of the women seen in our study did have also systemic lupus erythematosus, and this can also cause a scarring alopecia that clinically looks similar to Lichen Planopilaris. But in these patients, the clinical pathologic correlation, the appearance of the tissue on biopsy, really allowed us to show.
So someone in my family has lupus. And so to hear that people in the study also had lupus is this a precursor to know that you may have lupus? Or is this something that after having lupus could impact you, right? Or is this something that may be genetically in you and could happen? I don't know, but he in his video, he's like, yeah, and this happened too. Like, it was such an intriguing fact to him. To me, is this something that you're also telling your colleagues, and this is coming to people who suffer, and you find out, you diagnose them so they can learn more and say, hey, could this be something that could be bigger and greater, and I need to look at it further?
That these patients truly had Lichen Planopilaris as well as systemic lupus, and not just hair loss from lupus itself. To summarize, this is the second largest study that's been done on women with Lichen Planopilaris. The typical woman that presents with Lichen Planopilaris is a patient that has hair loss, mostly in the vertex scalp. If you look at the scalp, it usually has some scarring alopecia.
This is the second largest study done. I think he said 2, maybe I'm wrong. Like, record it, rewind it back.
To summarize, this is the second largest study that's been done on women with lichen planopilaris.
200 women, 200 something women, the largest study they've done. 200 people? Y'all could do better.
These patients may have associated autoimmune conditions. Close to a third of these patients actually have vulvar or oral lichen planus, as well as half of these patients have body lichen planus. Half of these patients have other autoimmune conditions.
Half. Oh, guys. It's sad. It makes me want to tear up. Half have other autoimmune diseases. So what does that say? What does it say? I think that's one of the greatest pieces of information that I'm learning from this, is that you have to be aware. If you have Lichen Planopilaris, you need to be cautious and vigilant on your health and look at if you have other underlying diseases.
Screening for anxiety, depression, sleep disturbances may be prudent in patients with lichen planopilaris. Treatments of these patients often requires systemic therapy as well as topical therapy. Usually combination therapy has been shown to be the best, and this was the case in our patient population. Hydroxychloroquine was a medication that many of these patients took, and if there was disease stabilization, this usually required 13 months to stabilize.
Okay, guys, that is pretty much the end of the video, I believe. Hydroxychloroquine. Remember that drug that former president was toting around? I know that it's also used with lupus patients, and I think to suppress your immune system, right? You're taking this and then also do a topical, and it works. But you have to be at a place where you still don't have scarring to get your hair back. So to me, it's very much prudent that they do a better job of early diagnosis and knowing the precursors to it, and what could happen next, right? So he gave us some things. Obviously, other autoimmune diseases could be a precursor. Possibly having peripheral body hair, so having no hair on your legs, maybe on your arms, maybe having barely any eyebrows. I know when I was told, I also was told about my nail beds, which I found out that discoloration in your nail beds could be a precursor or could show that you have some autoimmune disease. And also, obviously, if you're seeing some kind of hair loss, a flaky scalp, the pupils, the pupils, I don't know exactly how to say it. If you're seeing those bumps, then that also can be an issue. So those are some of the ways that you can pretty much see in advance or see that you may have this issue, or when I think a doctor's diagnosing, he can see these issues early on and really help you out with next steps, treatment, and other possible concerns you may have. Guys, there's a lot, right? We still have to learn about this disease. And with these reports, obviously we get some more insight. I would love to talk to this doctor. So guys, if you want me to, maybe you should comment down in his comment section. Mayo Clinic, let's connect with Vic-E, or anyone else you think may be a great person for me to interview. Please link it down below, or even tag them or tell them about what I'm doing so I can talk with them so we can all learn more about this disease. Guys, thanks again for watching another video. I plan to continue to create content on this topic because it's something I'm passionate about and personally that applies to me. So I'm wishing you all well. Stay up. And until next time, peace.